We started this session with biostatistics. Sean is a joint appointee with us and CHS, and now we go full-fledged at CHS to Randall Kuhn. Randall has also a really, a lot of experience, rich experience in dealing with big data, and he's going to be talking about inadequacies of complex data systems currently available for answering complex policy questions. And I have a very special place in my heart for Randall because he's the only person I think in this school who speaks Bengali, which happens to be my mother tongue as well. There you go, Randall.
খুবই ভালো.
Which means very good.
Yes. Well, that's all that's left of my Bangla. But at least we don't have to do the fun fact. Sudipto took care of that. Oh my gosh, that sonification. How am I going to top that? Well, I'm not even going to try. Helpfully, I think I'm going to be describing the space of homelessness where, in a way, we need some of the big data that Sean and Hua are describing. I already have some questions for Hua, actually, about the VA data. Of course, the trick is homelessness is a very urgent crisis that affects us all, but most notably affects the many people whose lives are in jeopardy every single day living on the streets. And homelessness is what I actually came to this university from a School of International Studies. And it's what we in the world of international affairs and certainly in my previous work in global health, we often encountered what we called a wicked problem. And they're just like big data. A wicked problem has no particular definition. It doesn't mean wicked like a wicked witch. It means basically a problem that is really, really complicated. And there are some specific dimensions to that, like both chronic and acute. And again, these all describe homelessness, both long-term and short-term consequences, solutions across multiple systems, devastating consequences, a problem that the closer you get to solving it, the harder it gets, right? Because we know, as with many problems like infectious disease, that we start with the easy cases, and then we're left with the hardest cases. And so it gets harder and harder, and it's operating across multiple systems. And so part of the premise of this talk is to sort of say what we don't have, right? Which is you would think that if we sort of take this systems view of homelessness, or if we take just the very seeming intractability of homelessness at our ground level view that we see in our lives, or if we take the complexity of the system. This is the county's, believe it or not, this is LA County's new revised simplified diagram for tackling homelessness. The previous one had all these lettered and color-coded different programs that was just a nightmare. So you would think that a problem this complicated would have data systems that could represent the complexity of the problem. And you would think that a problem that can kill a person, bring a person from functioning very well, thank you, in a tent, in ways that we could never imagine, can go from functioning to dead in a matter of days, that we would have rapid response data systems that could meet the needs of this population. And of course, I'm here to say that we don't. Right? What we have is a system of periodic interactions between the system and homeless people, all mediated by caseworkers, right? No mechanism for people to self-assess. Like we think about all the different systems where we self-assess, like say before we check in to health providers. And again, we can think about all the ways that our own health networks could use a lot more kind of data collection. And we know health and hospital systems are doing more and more to collect data on social determinants of health. But right, we have a system where all data systems are sporadic and selective in their coverage, where the decision for caseworkers to enter data comes at the cost of, do I actually help this person or do I enter their data? And systems that are fragmented, incomplete, and basically what I want to argue is not based on the person. And I'm probably going to jump through this. The basic premise of this slide is just that most of what we know about homelessness in LA County comes from what we call the point-in-time count. I'm part of the team that runs the point-in-time count. It's one of many great USC-UCLA partnerships that my work involves. And it's basically a count where citizens go out and count dwellings, tents, campers, so on. And then there's a survey that we run that estimates who's actually in those tents and campers and so on. And that's basically the foundation of what we know about how we're doing on homelessness in LA, is a single night count by lay people, by citizens, of the number of tents, and then a survey conducted once a year, right? You're homeless all year round, but we only have data on you in January, right? That estimates the number of people and some facts about the composition. And then we can observe that change from year to year. What happens during the year is we have these administrative databases, much like the administrative databases that Sean describes, except utterly fragmented, right? And so one challenge with homelessness is we don't learn that you're homeless the day you become homeless. And so there's that critical period right when you become homeless, when you're unobserved. That is sort of understandable. And that's one of the places that we could think about using big data to try to fill in some of the gaps in who is out there that we're not detecting. We are also using mobile surveys to, come up with novel ways of tracking more quickly how people's lives are unfolding. Where you'd think there might be better data was in the housing system. So I was actually just on a call with some folks from eBay who were very interested in our survey work. I don't know why. But I basically had to tell them there's nothing, like users would imagine that our housing system, given that we're distributing 20,000 housing units a year, that we would have something like Airbnb, where a client could state their preferences, like I need to keep my pets, I need to be with my partner, I need to keep my stuff, I want to be sober, I want to be high. All these preferences that are pretty reasonable preferences to have. And more importantly, we know from our data that people have exercised their preferences. They are less likely to accept housing if they have stronger preferences, right? That you would think there's a database where someone could enter in their preferences and see the units that meet their preferences. And I had to inform them, quite the contrary. There is no database of housing. Not only is there no matching system, there's no database of housing. That is just in its rudimentary phase to actually have a database of what housing is out there, much less make it searchable. And then our work is really trying to get just at the very beginning, using mobile surveys to get an idea of what are people's preferences? What housing do they actually want? And then that's before we get to the question of when someone gets housed, do they actually stay in housing? And so, and again, the consequence of all this from the human, right? So part of what we're working on, and I'm already down to 1 minute, and of course I'm gonna go a little over, but I'm not gonna get to all the details of this, but part of what we're trying to do is say, how can we use all the data that are available? That is some classic big data like Twitter and things like that, but mostly an administrative database, data sets that are rationalized and organized into a system, and with a backbone of surveys where we actually ask people how they're doing. What do you want? What do you need? Are you recovering? Are you staying in your housing? Are you progressing from interim housing to permanent housing? And of course, are you surviving? And so I'll just say part of what we're doing, I'm not going to go into all the results, but we're running a real-time survey project called Periodic Assessment of Trajectories of Housing, Homelessness, and Health, where during the annual homeless demographic survey, our amazing team members, most of whom have lived experience of homelessness themselves, enroll people either by an enrollment card or using a little phone app, enroll them in a survey, not some fancy app. Again, we hear about a lot of people will say, oh, I'm going to design this amazing app that's going to navigate people through homelessness. And right, if solving homelessness were that easy that an app could do it, then we'd be having more success with doing it the old-fashioned way. We do need volume, right? We need ways for people to access services themselves, to solve problems themselves, but we need to do it in a human-centered, trauma-informed way. And so we have just a text message that links you to a survey that we spent a lot of time working on the plain language, trauma-informed language, just ways to make a survey appealing. Like, how do you answer, what are the barriers to answering a survey if you're living under a bridge? And you barely have any battery power. And so that is, and the principal insight to all this is that 80 to 90% of unhoused people in LA have a phone. Not all of them have the phone turned on or have power or have the same phone number. So we're working through those challenges. During the pandemic, we figured out ways to deliver electronic gift cards, including some slightly healthy options for these surveys. Again, there's a data visualization platform and a report that we issued last fall that describes that we've been able to generate a survey that is representative of LA's homeless population. We follow them every month. We just are working with the UCLA Institute for the Study of Hate on a new project to collect measures on exposure to everyday racism and violence. We just launched that survey and already have data flowing in. And this is a platform that supports quantitative and qualitative insight. In fact, because people's voices are so rarely heard, they actually love the opportunity to share qualitative insights, though we still try to not make the survey endless. We try to be mindful of their time. We do use administrative data. I'm not going to get to that. Here's some cool maps that my amazing PhD student, Jesse Chen, developed just using 311 data and other data sources to predict homelessness, right? So we can fill in some of the gaps on where new hotspots of homelessness are emerging during the course of the year. There is a little tiny bit of big data here, which is doing sentiment analysis on changing attitudes towards homelessness in the media. And yeah, I'll just leave it there. Sorry, I covered a lot of ground. We're just getting started. Thanks to our amazing partners at USC. We have a term for this, Bruins, Trojans working together, we're Brojans. Thanks to the Homeless Policy Research Institute, LA Homeless Services Authority. I know they get a lot of flack, but they're trying really hard. They're doing amazing work, and we're helping them become more lean and mean. And also shout out to Venice Family Clinic. We work with them on a new project mining their electronic health records from 15 years of street medicine practice to try to help all these cool street medicine programs actually make an impact. So thanks to you all.